Good morning and welcome to the weekly update from the Department of Behavioral Health. I had to catch myself. Rarely have we done these in the morning. I'm usually saying good afternoon, so forgive me if I make any mistakes in that regard. All right, September remains suicide prevention and addiction recovery month, and so you'll see a number of educational offerings and other events that highlight this focus for this month. Moving on to COVID. All right, we're up to 225,520,088 cases across the world and over 4.6 million deaths. In the United States, 41,267,077 cases and 662,577 deaths. In California, probably of note is that our positivity rate is slightly down from 4.5 to 4.4%. That's somewhat stable. We are seeing deaths increase though. And remember, as our case rate goes down, our hospitalizations will drop, but we'll see an increase in deaths likely for a little while after this surge ends. In Fresno County, we're up to 122,650 cases of COVID and 1,853 deaths. That's an increase of 22 deaths. So again, in that lower right graph, you'll remember that we really started seeing the surge in the wintertime in December, and that those deaths really didn't peak until sometime in February. So we should expect to see those deaths continue to increase and peak. Our hope is that we won't see as many deaths. We do have some treatments that are being made available to individuals pre-hospitalized. If anyone who's watching this begins to develop symptoms of COVID, one thing they can give you before you're hospitalized is monoclonal antibodies. After hospitalization, Regeneron and dexamethasone or steroids are things that they do. So as we went through, we are learning more and more how to treat it. We can't always save everyone, but we are trying to apply that knowledge to ensure that for people who do get COVID, we give them the best possible chance. For youth, we're up to 24,100 or so cases of COVID. That's an increase of about 1,100 cases. You're really seeing, if you look at the graph on the left-hand side on the upper, that real swift increase, which we do think is related to a return to school. In terms of hospitalization, we have started coming down finally. If you'll recall, for several weeks, we were hovering between like 395 and 410. We're, as of yesterday, 371. We did actually get in the 360s the day before, but popped back up again. And hovering around 80 in the ICU. Only 9 ICU beds available, so we remain with a critical shortage of ICU beds. But our hospitalizations do appear to be coming down. In terms of youth, we're seeing the same trend. We saw that peak of hospitalizations just in the last several days. This graph shows it by day, so the peak was on roughly the 4th or 5th of September, right after school started. And so we do see a decline a little bit, although it looks like, we had a slight bump up a couple days ago as well. In terms of testing, our positivity rate is coming down a little bit. We had been at 9.1 at the end of last week, and now we're at 8.6. Pretty small decline, but at least going in the right direction. Vaccinations, we're now up to 1,065,993. And that represents 461,221 residents who are fully vaccinated and another almost 89,000 who are partially vaccinated. For youth, we're now up to 32,166 who are fully vaccinated and 40,182 with at least one dose. So cases continue to decline in Fresno County, hospitalizations finally starting to drop, deaths are increasing, and our positivity rate continues to decrease. So that graph we've been watching, remember the darker or blue line is representing California. The other line, the reddish colored or orange line, represents Fresno County. And so we're experiencing that drop a little after the state. This shows our comparison to the counties in Central California in terms of the tier. And you can see now that we have Madera and San Joaquin, whose positivity rate is in the red, but we're all remaining in what was the purple tier, or the tier with the worst numbers. So across California, we are seeing cases decline, hospitalizations are decreasing, and deaths are increasing. Of note, we also have the recall election today. Please, everyone, vote and have your voice heard in whatever outcome you're hoping for. I did want to show you in terms of the largest counties in California. There's 13 of us that have populations pre-2021 of 750,000 or over. And I wanted to really point out for you what those hospitalization per 100,000 in population. So this is really an attempt to, if you will, level the playing field. So show you per 100,000 population, what is the number of people hospitalized, and then how does that compare to the vaccination rate for that county? So I took the highest vaccination rates that are in Santa Clara and San Francisco County. Those are on the left-hand side. They have 73 and 72% of their residents over the age of 12 who are vaccinated. And they also have the lowest hospitalization rates. And then if you go on down towards the right-hand side, you're going to see Fresno County. Fresno and Kern of the large counties have the highest hospitalization rates and also some of the lowest vaccination rates. So I just wanted you to see that, you know, if you go from left to right, Santa Clara, San Francisco, Contra Costa, Alameda, Ventura, and Orange, as well as Los Angeles, all have vaccination rates above 55%. And all of them have relatively lower hospitalization rates than the rest of us. You start with Sacramento at a vaccination rate of 54% and go down to Kern at 40. The rest of us are 48, 47, 45. And we all have much higher hospitalization rates. So whatever you're hearing, whatever you're thinking, whatever's helping to inform your decision making, I wanted you to see that where we have the highest vaccination, we have the lowest hospitalization. And furthermore, we've also learned in the past few weeks that for individuals hospitalized, typically more than 85% of them are unvaccinated. And so as you're making your decisions, keep those facts in mind. All right, nationally, cases are trending down overall, but some states remain with surges. This has been the case for the last several weeks. There have been a number of new planned vaccine mandates. You might have heard from President Biden, everything from any employer over 100, as well as all federal employees, et cetera. Those are going to have to go through a regulatory process, and so you may not see those actually happening until and if that regulatory process occurs. I did want to remind you nationally, this is in the last few months to show you that cases and hospitalizations and deaths all are overrepresented by not fully vaccinated folks. And so while cases, hospitalizations, and deaths do occur in vaccinated people, it is a much smaller percentage of those cases, hospitalizations, and deaths than the not fully vaccinated folks. All right, that's all I'm going to go over today. I will take any of your questions. We saw something that the slides were cut off. Hopefully that got fixed. I can see on the screen that they're not cut off, so hopefully that's fixed. And then someone mentioned that in Florida, where they've disallowed mask mandates, child COVID deaths have doubled since they've returned to school. Definitely with the Delta surge, which we know is more contagious, we don't have evidence at this point that it has more severe disease process. So anytime something's more contagious, you're going to see more of everything. So it's not necessarily that it's more deadly, it's that more people are getting it, and if a certain percentage of people who get it get hospitalized and a certain percentage of those die, then any population that's impacted by a more contagious virus will have more hospitalizations and more deaths. And so if you're not wearing masks, if you're not encouraging vaccinations, if you're not practicing the social distance, with a more contagious variant, more people are going to get it. When more people get it, more people are going to die. And so in states like Florida, where they're really discouraging mask mandates and not I don't know what they're doing with vaccinations, frankly, you are seeing more cases in all populations, including children. And then of 4 people, 85% are unvaccinated. I think the fewer number that you're representing, the less reliable that statistic is in terms of representing that number. So let me give you an example. If there's 100 people in our department, right now about 80% of them are vaccinated. That doesn't mean that if 10 people are in a room, 8 of them are vaccinated, because you might be with, there's 20 people out of 100. If 20 people are in a room and they all represent unvaccinated, then none of the people are vaccinated. So the smaller the number you get, the harder it is to use those overall percentages to represent what's happening in that particular space. I hope that makes sense, but when we're talking about large swaths of people, maybe in your family no one's vaccinated, so if you were the 4, you're just not representative of the larger sample. In my family, in my household, 100% of the people are vaccinated, so we're also not representative of that larger sample. So the smaller you get, the less reliable the overall numbers are going to be. Do I recommend that vaccinated individuals avoid public gyms like GB3? This is a situation where every person has to make a decision based on what's best for them. And I'm going to give you an example of some choices I've made. I do work out in a place with other people. I take spin classes at a private gym. And in the midst of the pandemic, all of the spin classes were moved outside. It meant for some hot days in the summertime, and it meant for some cold days in the wintertime. But I just layered on in the wintertime and suffered through it in the summertime. Now, last summer, when we were working out outside and had the smoke, we just couldn't work out because of the smoke. Then as time passed and we were able to go back inside, we had to wear masks. And so I did go back. I wore a really good tight-fitting mask. It wasn't super comfortable, but that was a risk I was willing to take because I was vaccinated at that point. And then over time, as more and more people got vaccinated, we were offered the opportunity that if we showed our vaccine card and we had to show it in person, then we could go without masks in that environment. And most people chose to do so. Now, I'm going to be honest with you, and one person who was unvaccinated did go unmasked without us knowing and did get COVID and was hospitalized for quite a bit of time. But no one else actually got it, and we were all exposed. And so I think, again, you have to make your own determination. Is there any sort of vaccine mandate rules in that setting? Are people, including yourself, wearing masks? What is the setting itself like? Is it wide open with open air? Are you indoors, outdoors? Is it small places with lots of people? All of those things have to be factored in, and that's why this whole pandemic and these rules are so hard, right? I often hear people make try and make equivalencies, we'll say, and say, well, I don't understand why I have to wear a mask in the work setting because people aren't wearing masks in grocery stores. Okay, but you don't have to go in the grocery store, and you can choose to wear a mask, and you can pick a time of day that you go where you feel like you're safer, or if you don't care, you just don't care. But in the work setting, we're trying to keep people safe. And so when it's an optional thing like working out, you're going to have to make your own best decision. And hopefully you'll take all of those things into consideration. All right, any other questions? No. And so, as we're moving forward and we're having hospitalizations and cases go down, we are not at a point, I think I talked about this last week, we're just not at a point yet where the virus is endemic. Several weeks ago, someone put in a question, well, why aren't you talking about viruses becoming endemic? And so next week, I'll really focus on what does it mean for a virus to become endemic, which is where, we have lots of viruses that are endemic for us right now. The most common one being the common cold, right? It's endemic. It started out as a virus probably in the beginning before people had exposure to it and immunity. Common colds could kill people. And so over time, as we all developed some immunity because we were all exposed and the virus had less and less mutations, it became endemic to our community. So we experience it and it's not deadly for us. The problem with COVID is that it is highly contagious and it is throughout the world. That's what a pandemic means as opposed to an epidemic. An epidemic meaning that it's prevalent in areas but not necessarily across the world. When it's there across the world, it becomes pandemic. And so in some regard, even with all of the precautions we're taking and as much as we get people vaccinated, there is still variants that could emerge in other parts of the world where they're not as far along with things like vaccination. And so that is what's going to keep COVID from becoming endemic. And we'll talk about that a little bit next week. Like, what does it mean and what has to occur in order for it to be endemic? The other thing I'll talk about next week a little more, I have had questions about the safety of the vaccines and how vaccines develop and what do we know or what don't we know about the long-term effects of vaccines. And so we'll talk a little bit about that as well. All right, we have another question. What happens after September 30th to those that are not vaccinated? For individuals who are not vaccinated, who should be currently testing weekly, you should have received a notification from Human Resources about what you are required to do. And so I know that the Maine HR is also developing notifications in terms of that September 30th deadline. And that is something that we as a department don't control. That's done through Maine County and Maine HR. What I will tell you is you have time to begin the vaccination process, and you also have time to file either a medical exemption or a religious exemption. And just as a reminder, if you believe you have a medical condition that would preclude you from getting the vaccine either temporarily or permanently, you need to have a signed note from a healthcare provider. And if you look at our form, which is available through Human Resources, you can see what kind of healthcare provider. I believe it's a number of designations like nurse practitioners, doctors, etc. And then if you also have a firmly held religious belief that you feel precludes you from taking a vaccine as well, you take the same form and you simply check the box, sign it, and turn that in. And so there are ways for you to become exempted from taking the vaccine. If you qualify for those exemptions, you will be required to continue to test weekly. There is no exemption out of the testing requirement. And so if you do qualify for an exemption, you will have to be tested weekly. You cannot exempt out of that. And so as far as if you are not vaccinated, you do not ask for an exemption, what will happen to you? That is something that the county will be notifying you of what the consequences of that will be. All right. What are the options for testing on weekends? I know someone who couldn't find an appointment at a drugstore for a few weeks out. And so as far as general testing on the weekends, there are a few places. I know that UCSF, the COVID Equity Project, has a drive-through testing across the street from Fashion Fair, and that is, roughly in the UC building across the street, which is just east of Men's Warehouse. I know because I went there for testing, drive-through testing. And so that is still available. It's, first come, first served. There's not really appointments there. It is drive-through. And so I know that that's one. But if you go on the county's public health website, you should be able to find all of the testing resources. And they really highlight those testing resources that are free to the public. Efficacy for preventing infection among vaccinated individuals has been diminishing with variants. Yes, that is true. At this point, we believe that it diminishes it by a few percentage points. So the mRNA vaccines were found to be 95% or so effective. They might go down as low as 88% or so. Again, some of this we'll find over time. Could there be a variant that develops for which the vaccines are not effective? Absolutely, that could happen. I wouldn't say that it couldn't happen, but thus far, what we're finding is that the vaccines remain very, very effective, much more effective than even some other vaccines that we have. And when I go over vaccines next week, we'll talk about this in a lot more detail. I think it's really easy to say, oh, well, they're not as effective, might as well not get it. But honestly, the reduction in with the variants is not enough really to make the decision not to get vaccinated if you're making the decision based on facts. All right. What is the September 30th vaccine mandate for the county? It's not a county mandate. This is a state mandate for healthcare providers that you have to have either the second of a 2-shot regimen or the first of a 1-shot regimen by September 30th in order to work in a healthcare setting. And that is, there's a list, and you can go on either the Department of Public Health for the state, CDPH's website, or the Department of Healthcare Services, because they have a separate order for behavioral health providers that describes what are the settings that this applies to, who are the staff that this applies to, and look up that information for yourself. Will natural immunity be recognized as vaccinated? My plasma saves lives, but I am considered unvaccinated. At this point, you have to be vaccinated whether you've had COVID or not. And this is because in the studies they have done, and I could talk about this a little more next week with some precise information, but in the studies that they have done, the vaccines appear to be providing more protection than natural immunity, which means natural immunity being a person who's had COVID and developed antibodies as a result of COVID. And so what they're finding is that that vaccination provides more protection. If you have had COVID within the last 90 days, I believe that that would exempt you from the testing mandate, but I don't know that it would exempt you from the vaccine mandate. Yes, are unvaccinated people that are getting tested weekly required to furnish their results to DBH? Yes, Human Resources is keeping track of all of this and working with Maine HR and County Council when people refuse to get tested or do not provide their test results. So please rest assured that we are working very closely with the county on the consequences of not complying with the testing or the vaccine mandate. Again, that direction will come from the county. Someone else just mentioned that with the variants possibly reducing the effectiveness of the vaccines, it just highlights the importance of the other precautions like masking. And that really is why we've chosen to mandate masking in our department. We want to provide as much protection for our staff and the people we serve as possible. We've done generally a pretty good job of mitigating spread of COVID within our department. We want to keep that up. And so vaccinations are one way and the precautions are another way. All right, let me see if there's any more questions. I don't see any questions. Again, next week I'll really focus on how vaccines are developed, and we'll give you some more information about the effectiveness of the vaccines. And with that, we will end for today, and we will see you next week.